Hello all, welcome to my channel Today's Physiology and Tomorrow's Medicine. I am Dr. Rekha. I am going to crack a NEET PG question from the blood chapter. So the question is, a 19-year-old female presents with recurrent episodes of epistaxis and menorrhagia since adolescence. There is a positive family history of bleeding disorders. On investigation, platelet count is normal, PT and APTT are within normal limits. Ristocetin cofactor assay is decreased. So, which of the following is the most likely diagnosis? The options are hemophilia A, idiopathic thrombocytopenic purpura, von Willebrand disease, and Bernard-Soulier syndrome. So, we are going to rule out one option by other option. First, we will see the option A, hemophilia. When you see the inheritance pattern, this is an X-linked recessive inheritance. So, the gene present in the X chromosome. So, most likely the male will be having the disease and the females will be the carriers. It affects only males, females will be carriers. So, in the question, it is given as the disease is seen in female. So, for now, we can rule out the hemophilia. The next option is ITP, that is idiopathic thrombocytopenic purpura. As the name suggests, there will be thrombocytopenia, that is decrease in platelet count. But in the question, the platelet count is normal. So we are ruling out the ITP here. Then coming to the third option, Bernard-Soulier syndrome. First, you have to know on the surface of platelets, we are having glycoproteins. So glycoprotein 1b 9, 5 and glycoprotein 4. So the Bernard-Soulier syndrome is nothing but it's a deficiency of this glycoprotein 1b95 complex. So the problem will be in the platelet adhesion. So this is characterized by large platelets and also thrombocytopenia is seen in Bernard-Soulier syndrome. Here again the platelet count is normal, so we are ruling out the Bernard-Soulier syndrome. So we have left with only an option von Willebrand disease. First you have to know what is von Willebrand factor. So if you see here, this is a von Willebrand factor and it has a role when there is an endothelial injury. This one millibrand factor is the one which helps in the platelet for adhesion. So the one millibrand factor is essential for the normal for the platelet adhesion. So with the deficiency of 1 milligram factors is seen in 1 milligram disease. So in that case, there will be recurrent episodes of epistaxis or menorrhagia will be seen. So from this explanation, it is evident that the 1 milligram disease may be the right answer, and also the point which supports this is ristocetin cofactor assay. What is ristocetin cofactor activity is when you have the lattice particle coated with recombinant glycoprotein 1b and you are combining that with ristocetin, and if you are going to add the 1 millibrand factor, there will be activity between the 1 millibrand factor and the latex. So if there is deficiency of 1 millibrand factor, this activity is going to decrease. So in the question it is given as decreased ristocetin cofactor activity, which indirectly tells that there is deficiency of 1 millibrand factor. So the answer is 1 millibrand disease. So from this explanation, it is clearly evident that this is a case of 1 millibrand disease. We are ruling out the hemophilia since it is occurring in the female, and ITP as the name suggests, it is thrombocytopenia is not seen here, and Bernard-Soulier syndrome also there will be thrombocytopenia. So the correct option is 1 millibrand disease. So what we have learned today is 1 millibrand factor is essential for the platelet adhesion. Not only that, this is ristocetin cofactor assay. It is done to assess the activity of 1 millibrand factor. So this activity is decreased in 1 millibrand disease. All the best. Thank you.